Hi, everybody. I'm David Asman. Thanks for joining us tonight. First up, it was supposed to be a slam dunk. The slick politicians from D.C. were going to educate the rest of us about why we need a new trillion-dollar government solution to our health care woes. But instead, it was the politicians who got the education and an earful from constituents who are really fed up with a government power grab. Now, the people sense that government is getting addicted to all its new money and power, and like all addicts, they want more and more and more. So the people are fighting back and demanding to be heard. They turned these town meetings 180 degrees around and told the politicians enough. And it's happening all over the country. In Connecticut, it was embattled Chris Dodd who heard from the people. Here's how it sounded.
Why is it off the table? No, not in a minute. I want an answer right now. Why is single payer off the table? I want to know why single payer is off the table. I'm not leaving.
All right, in Wisconsin, it was Congressman Kagan who had to be educated. And in Pennsylvania, it was Senator Arlen Specter who got an earful.
What I see is a bureaucratic nightmare, Senator. Medicaid is broke. Medicare is broke. Social Security is broke. And you want us to believe that a government that can't even run a cash for clunkers program is going to run 1/7 of our U.S. economy. No, sir.
That got a standing ovation. Joining me now are two Americans who actually got involved in two of these town meetings. Karen Stocking is of the Philadelphia Tea Party Patriots, and Anna Puig of Thomas Jefferson Club. They're both joining me today from Philadelphia, and Anna was at the town meeting with Senator Arlen Specter and asked the senator a question. First of all, what was the question, Anna?
Well, first of all, I made a statement because I wanted to capture the crowd. My intention going there was to capture the attention of the crowd and try to educate the other side. So I basically said, you know, I'm a person who immigrated from Brazil legally. I've been paying my taxes all along the way. I have worked hard to attain life, liberty, and the pursuit of happiness, which is what America is all about. So once I had all of them cheering for me, and I had Sebelius and Specter both looking at me smiling because they probably thought she's, you know, fits the Latina profile, she's going to be on our side. I just asked them, why is it that you're trying to change the system and turn America into an entitlement system that has been proven not to work all over the world?
And they also got an immigrant to this country complaining about all the illegal immigrants that would benefit from a government socialized program.
Exactly. And, you know, they started putting out numbers at the town hall meeting that I completely disagree with, and the grassroots movements completely disagree with, because they're not factual. The 47 million number of uninsured Americans is not a factual figure.
Now, Karen, your father is 82, your mother is 80, and coincidentally, that is exactly how old my father and mother are. So I can identify with your particular situation. Are they clearly in your focus right now as we turn to the prospect of socialized medicine?
Well, let me tell you one thing. First thing, this year, in 2010, my mom will be 80 and my dad will be 82, so they're approaching that time. But yeah, actually, my dad is scheduled to have an MRI on his pancreas, and you know, that is something that I want him to have the option to do. If he wants it, if he needs it, I want him to have it regardless of the cost. And he's got a great health care plan. He's got a great copay, a small copay compared to what it costs for a full MRI. And I want them to have the choices that I've had all my life. I want everybody in America to have those same choices, and I want women that are going to have babies to have natal choices for their family and all Americans. This has got to come down, that there's got to be somebody that's going to represent America. And our folks in Congress, the Senate, the White House, they ain't cutting it anymore. Yeah. It's all about them.
Karen, you mentioned the word choice, and Anna, I know that you experienced British health care. I had about a month's worth of British health care because my wife was sick there, and it was not a pleasant experience. But you also had experience with British health care, and that, I guess, played into your feelings about how socialized medicine works.
Oh, it sure does. I lived in England for 3 years, and I see them trying to implement here the same thing that was done, that has been done in England for so many years now, and it does not work. I lived it. I felt it in my own skin. I delivered a child under the British NHS system, and there is no care. There is a ration of care. And single-payer healthcare system is a code word for nationalized healthcare system, which is what the British people have in place today. And it does not work.
Now, Karen,
there is a lack of...
Today we had the president come out and say that he was not in favor of single payer, even though he has been quoted in the past as saying he was in favor of single payer. Barney Frank at least has the honesty to come out and say that that's what he's in favor of. But do you think the president is believed by Americans when he says that's not his goal?
Ooh, let me just say how disingenuous that is when we've got video showing Barack Obama saying that he's absolutely in favor of single-payer care. Right in front of the SEIU, I think it was 2003, something like that, saying, oh, yeah, that's what he's for. Don't be fooled, America. There's one thing's coming out of their mouth, and they're voting on a completely different thing. So it's time for people to get up off of their recliners, put the latte down, and get out on the streets with us and start to take our country back.
Well, Anna, you know, a lot of people look at what happened over the weekend, and it was amazing how it was countrywide in Wisconsin, Texas, Connecticut, Pennsylvania, New York, all of these different states at which these town meetings, and again, to emphasize, which were arranged by the congresspeople and senators who were in favor of a government change to our health care system, they were pretty much treated the same everywhere. Was this organized by Republicans, or was it grassroots?
Look, we are all about grassroots. Last year, I tell people all the time, a year ago, I was screaming at my TV, and I decided to get off my couch, stop sipping my latte, and motivate people, engage, and educate. So there's no money being funded. I pay for all of this out of my own pocket together with the people who are organizing our movements in Bucks
Karen,
County.
is it the same with you?
Absolutely. I run an organization in the Jeffersonville, West Norton area called We the People of Pennsylvania. We've got $30 in our bank account, 10 of which came from me. And, you know, we are totally grassroots. We are nonpartisan. We are not Democrats. We are not Republicans. We are Americans that want to see our country continue down a great path of capitalism, which has gotten us where we are today, and all of a sudden, they're trying to take us away. I'm real happy with my health care. So are about 255 million other people. If we've really genuinely got 46 million people that don't have health care, let's deal with them and let's let the rest of us alone.
Well, and Anna, as you pointed out, Anna, there are 12 million of those who are illegal immigrants. There are several million others who have decided by their own choice not to take health insurance, as I did when I was in my 20s. So, I mean, if there are about 10 to 20 million that remain who really do need health insurance but can't afford it, should we look for an option for them?
Sure, absolutely. We should look for an option for them, but we should not penalize 96% of Americans who are happy with what they have currently because of 4% of the country. Sure, let's implement, you know, healthcare system, government nationalized healthcare system for those people who don't have care today. I'm not opposed to that. The Thomas Jefferson Club is not opposed to that, but I just don't want to see the silent majority be penalized, and this is why we are no longer going to be the silent majority in this country.
Anna
We're tired of.
Stay with us if you can. I'm sorry to cut you off, but we've got to move on to a panel. But I want to keep you as expert witnesses, if you don't mind. Will the blowback Democrats got from their town meetings actually change anybody's mind on health care, including some of those in Congress who are sitting on the fence? Former Bush administration